talk about ingrown toenails, and they're a very common condition in which the corner or the side of a toenail grows into soft flesh, and it results in pain, inflamed skin, swelling, sometimes an infection. Ingrown toenails usually affect the big toe, but it can affect any of your other toes. And the condition often happens when people cut their toenails by rounding or tapering the corner of their nails instead of cutting them straight across. If the toenail curves with the shape of your toe, it can actually grow into the skin. Sometimes trauma or injury to the toe, perhaps with a fall, can cause an ingrown toenail. And if you wear shoes that are too tight or ill-fitting, that's a problem too. And some people don't even recognize that they have an ingrown toenail, and this is because they have nerve damage from diabetes or something else. They can't even feel the injury or the damage to the toe, and that's dangerous. Thick or deformed toenails can also be a risk. Anyway, so ingrown toenails are generally common. They don't pose a risk to healthy people usually, but what about our hospice patients? We often admit older patients, they can't even reach their feet for care, or they've really neglected their feet because they're so tired and have so much malaise from their illness. Our patients may have any number of reasons for ingrown toenails, so of course for us it's really important to do a full assessment of the body, including the feet and the toenails. We know that falls are not an unusual occurrence in hospice patients, and this may also lead to foot damage, trauma, and causing an ingrown toenail. So what do we look for? We look for pain, especially when the patient is walking or wearing shoes. There can be some redness and swelling around the affected toe, and this can cause tenderness whenever we touch the toe. The toe can actually feel warm or even hot to the touch, and it can be swollen. Sometimes there's even drainage or pus that comes out in severe cases. So what do you do if you're a hospice patient? First of all, just soak the feet. Get a bucket or a big bowl and soak the feet in Epsom salts or salt water every day, as hot as they can stand it. Family may have to do this if the patient lives at home, or if you're in a facility, you might have to write an order to get this treatment done. After soaking, really dry the foot well, especially in between the toes, as this is where a fungal infection can begin and cause further problems. Then apply an antiseptic ointment to the area, like an over-the-counter antibiotic ointment. If you can see where the nail is pushing into the skin, you can use a cotton ball or even a nail tool to lift it up and try to get it away from the skin. Once your care is complete, you might consider putting on a Band-Aid to hold the ointment in place, and then of course nice clean socks. Unfortunately, our interventions may not be enough, and if it's severely infected, the doctor might order an oral antibiotic. Sometimes medical intervention is definitely needed, and the nail has to be partially removed. This is done by injecting a numbing solution into the toe, and then part of the nail is cut away in a surgical procedure. So how can we help our patients avoid ingrown toenails? We already talked about cutting it straight across. And let me say, Brenda and I love to do nails. We carry nail kits with us, like this one, because it's really good to provide nail care, and it's a great way to be sitting there giving nail care, and you're getting to know your patient, doing some, life review. Lastly, let's review how to prevent ingrown toenails. So again, cut the nails straight across, not at an angle. And do this generally after a bath or even a foot soak so that the nails aren't hard and brittle. Evaluate their footwear. Make sure they're not wearing shoes that don't fit properly, and of course, not ones that are slippery, because we don't want them to fall. Keep the skin clean and moist with lotion. If your patient has diabetes or poor circulation with peripheral vascular disease, it's really important to be extra careful when cutting the nails. Got to avoid injury during the care, because infection could be really hard to heal. Some agencies don't even allow care aides to provide nail care to patients with diabetes for this exact reason. That's it on ingrown toenails. So thanks for watching. Get our booklet, go to the YouTube, the Hospice Care Plan, watch us for a lot more information on how to take care of your patients, because our motto is care is treatment.